Alcohol cravings can change on Wegovy or Zepbound, sometimes before major weight loss appears. In a 2026 trial, Semaglutide reduced days with heavy drinking beyond placebo plus counseling. Participants had obesity and alcohol use disorder. Neither drug is approved for alcohol treatment. Semaglutide, Wegovy's active drug, has direct human trial evidence. Tirzepatide, Zepbound's active drug, has promising but weaker evidence. Wegovy contains semaglutide, while Zepbound contains tirzepatide. Both activate gut hormone signals involved in appetite. Those same signals may also influence reward and reduce the urge to drink alcohol. A drink may feel less interesting or easier to leave. This effect is different from simply feeling full. Reduced drinking can reflect two different experiences. Some people feel less desire before the first sip. Others still want alcohol, but nausea or early fullness makes drinking unpleasant. The first pattern more strongly suggests a change in craving. Dopamine helps drive motivation. Alcohol activates reward circuits, teaching the brain to seek more. Signals activated by these drugs may weaken that learned reward. One possible result is less drive to continue after drinking starts. That does not mean these drugs block pleasure, intoxication, or poor judgment in real life. A person can still enjoy alcohol and become impaired. One drink may create less pressure for the second, third, or fourth. The strongest evidence came from a 2026 trial involving 108 adults. All had obesity and alcohol use disorder, meaning harmful or uncontrolled drinking. Both groups received counseling during the 26-week trial. Half received semaglutide, the others received placebo, an inactive injection. Days with heavy drinking fell by 41.1 percentage points in the medication group and 26.4 points in the placebo group. After adjustment, semaglutide showed a 13.7 percentage point advantage over placebo. Blood tests that reflect recent alcohol exposure supported the reported drinking pattern. Both groups improved, so the drug was not the only influence. Participants had obesity and actively wanted treatment. The trial cannot prove the same benefit in casual drinkers, people without obesity, or people not seeking treatment. To measure craving more directly, a smaller 2025 trial examined 48 adults with alcohol use disorder. Researchers assigned them to 9 weeks of low-dose semaglutide or placebo. Participants were not seeking alcohol treatment, so the trial did not require a plan to quit. Semaglutide lowered weekly craving, alcohol consumed in the lab, and drinks consumed on drinking days. Heavy drinking days also declined more over time. However, the number of drinking days did not significantly change. Average drinks across all days also did not clearly differ. That mixed result reveals a pattern. The drug appeared to reduce drinking intensity more clearly than drinking frequency. Someone might still drink twice each week, yet stop after 2 drinks instead of continuing through the evening. Reduced craving is not the same as treated addiction. Wegovy and Zepbound do not remove withdrawal risk, stress triggers, learned habits, or social pressure. A quieter urge does not make abrupt stopping safe for someone who drinks heavily every day. Alcohol withdrawal can cause shaking, sweating, vomiting, severe anxiety, hallucinations, seizures, or confusion. These symptoms can begin when someone tries to stop. Lower desire from a weight loss drug does not protect the brain from withdrawal after long-term heavy drinking. Risk depends on the person's drinking pattern. Skipping a second glass differs from needing alcohol in the morning. Morning drinking, blackouts, prior withdrawal, or repeated loss of control require an alcohol assessment before interpreting craving changes. After assessing withdrawal risk, reduced drinking may reflect lower reward or side effects. Less interest before drinking supports a true craving change. Wanting alcohol but avoiding it because of nausea points to side effects. Feeling sick after 1 drink may reflect slower stomach emptying, dehydration, or too little food. Timing helps separate the two patterns. A reward change often appears while planning the evening or seeing the first drink. A side effect response usually appears after eating, drinking, or increasing the dose. Both patterns reduce intake, but they do not mean the same thing. Alcohol can worsen nausea, reflux, dizziness, and dehydration during dose increases. Drinking without food raises low blood sugar risk with insulin or certain diabetes medicines. Repeated vomiting or inability to drink fluids is a warning sign, not a benefit. Daily routines can also overpower a weaker craving signal. Stress, insomnia, loneliness, social pressure, and easy alcohol access may keep drinking active. Someone may report less craving, yet continue nightly drinking because the routine never changed. The useful outcome is measurable behavior without new harm. Track standard drinks, drinking days, heavy drinking episodes, blackouts, and failed attempts to stop. Also note whether alcohol becomes easier to skip before drinking starts. That pattern matters more than saying alcohol tastes different. In the United States, one standard drink contains about 14 grams of pure alcohol. That is roughly 12 ounces of regular beer, 5 ounces of wine, or 1.5 ounces of spirits. Strong beer or a large wine pour may count as 2 or more. Compare the pattern before treatment with the pattern after a stable dose. Check whether the first drink became easier to skip. Count whether drinks per evening fell. Record whether you stopped because you felt satisfied, felt sick, ran out, or forced yourself. Control matters as much as quantity. Hiding alcohol, planning life around drinking, driving after drinking, or repeatedly breaking personal limits signals a larger problem. Fewer drinks on some nights do not erase those warning signs. Those warning signs need separate alcohol care, not a choice between weight loss drugs. Evidence for an alcohol effect also differs between the drugs. Surveys of Tirzepatide users and animal studies suggest less drinking, but they cannot prove cause and effect. Human trials are registered, but published randomized human results are not yet available. The possible alcohol effect should not decide the weight loss choice. Do not choose Wegovy over Zepbound for that effect alone. Choose between them for weight loss needs, medical history, side effects, access, and weight response. Neither is approved for alcohol treatment. Do not raise the dose simply because cravings have not changed. Dose decisions should follow weight response and side effects. Higher doses may worsen nausea without necessarily improving the alcohol effect. Human trials have not shown greater alcohol reduction at higher doses. Unchanged alcohol cravings also do not mean the drug is failing for weight loss. These outcomes can separate. One person may lose substantial weight without drinking less. Another may notice less alcohol interest before major weight change appears. When alcohol use disorder is present, proven treatment should remain available. Naltrexone can reduce alcohol reward, while acamprosate can help people stay alcohol-free. Counseling and support programs can be combined with medication rather than replaced by a weight loss injection. Safety also requires recognizing urgent symptoms. Seek urgent care for seizures, hallucinations, confusion, fainting, repeated vomiting, severe upper abdominal pain, or inability to keep fluids down. These signs can reflect dangerous withdrawal, dehydration, pancreas inflammation, or another serious problem. Without urgent symptoms, compare 4 weeks before treatment with 4 weeks on a stable dose. Note cravings before drinking, how much you drank, and why you stopped. This separates reduced reward from sickness and inaccurate recall. Evidence supports a possible alcohol effect. Wegovy may reduce craving and heavy drinking in some people. Zepbound remains promising but less proven. Judge the effect by safer, measurable behavior, not by taste changes alone or a few nights of nausea. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.